In this video, I'm going to show you this female reproductive model, and so we can learn all the reproductive structures of the human female. To orient yourself, this is the bladder here. Remember that the uterus sits on top of the bladder. Great design idea. And then this big tube back here, that is the rectum. Okay, so don't get that confused with anything else. That's embarrassing. The opening there is the anus. Okay, and then this is the rectum here. Okay, that's the digestive system. We'll talk about that in another video. In this video, we're going to talk about the reproductive system. We've got the uterus and the ovary here with the fimbri, these little finger-like extensions of the fallopian tube or the uterine tube connected there. The ovary is also held to the uterus with a ligament that you can see right there. Let me see if I can lift this up. There it is. There's the ovarian ligament. Okay, so let me take this off so we can see this full cross section. Now we can see our structures a little more easily. Here is our pubic symphysis. This is a cartilage pad that sits between the two anterior bones of the pelvis. Just above and behind that is the bladder, okay, with the urethra carrying urine out of the body. You can see the ureter, you can only see one of them, back here. There we go. That's the ureter carrying urine to the bladder here. You can see a little opening back there where the ureter enters, drains into the bladder. So ureter, bladder here, urethra there. This is the uterus, the dome-shaped opening of the uterus where it opens into the vagina is called the cervix. The little straight pathway here that goes through the cervix, that's the cervical canal, okay? From here up, that's the lumen of the uterus. And then the tube connecting the uterus to the outside environment is the vagina. Okay, that's the vagina. These places where these tubes open to the outside world are orifices. Remember, oro is our prefix that means mouth. So this is an opening this is the vaginal orifice where the vagina opens to the outside world. This is the urethral orifice, okay, where the urethra opens to the outside world. So remember, this stuff out here, it's not the vagina, okay? All of this exterior stuff, this is the vulva, not the vagina. The vulva includes this large flap of skin out here called the labium majus or the labia majora for two of them, and then the labium minus or the labia minora for two of them. That's the plural. And then this pad of fat and tissue is called the mons pubis. Okay, it kind of provides a pad in front of this pubic bone and pubic symphysis. Between the anterior labia minora, where these two meet, we find the clitoris. Okay, the clitoris evolves from the same tissues as the human penis, and it is an erectile structure. It has a glans at the tip covered with the folds of tissue here. It has a body or a shaft, and it has a root that anchors it into the pelvic floor, just like the penis has. Okay, so that is the clitoris. What else do we have? Let's go back to the uterus. In the uterus, we can see these three distinct layers of tissues. The inner one is the endometrium. The apical surface of the endometrium closest to the lumen is the part that thickens during the menstrual cycle and then is shed as menstrual bleeding. This inner layer, the middle layer, is called the myometrium. Myo means muscle. This layer gets thicker during pregnancy, so it increases strength so that it can push out the fetus. And then this outer layer with lots of blood vessels, this is the perimetrium. And that is, a connective tissue and blood vessels supplying these other layers. You can also see this little white layer on the outside, that and this part here, this white structure here, that is the broad ligament that extends. It's a big, wide, flat ligament that extends all the way across the uterus to hold it in place. And then again, we have the ovary, the fimbriae, the fallopian tube or the uterine tube that carries the ovulated oocyte to the uterus. If the fertilized egg implants here in the fallopian tube or anywhere outside here, it's an ectopic pregnancy. An ectopic pregnancy cannot develop inside the uterine tube. It must be removed. The woman can die from a burst fallopian or uterine tube. And yes, that is an abortion, and it is going to happen past 6 weeks of pregnancy. Normally, the blastocyst, which is the fertilized egg or zygote that has divided as it passed down through the fallopian tube, normally it's going to implant here and develop into the embryo and then the fetus, as well as the amniotic sac and the placenta and all of that stuff. Okay, so that's our female reproductive model. We've got the uterus with the endometrium, myometrium, perimetrium, the cervix, the vagina, labium minora, labium minus, labium majus, clitoris, not part of the reproductive system, but important to know, the urethra and the bladder, and the rectum back here, back to the reproductive system, fallopian tube or uterine tube, fimbriae of the uterine tube, ovary, ovarian ligament, and broad ligament holding the uterus in place. There's your model.